Hi, and welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat, and on this episode, I am joined by Dr. Phindile Chowa. She is an emergency trained physician currently practicing in the state of Georgia. She attended the University of Pittsburgh and completed her residency in emergency medicine at Harvard University. In this episode today, she is sharing her personal experience after going through a miscarriage and then a subsequent pregnancy filled with anxiety and fear of loss, and then going on from there to have a really difficult delivery and a very difficult time in the postpartum period. And she's sharing how that experience, for one, changed her life, and how she worked through that period of time to the point where she realized that the system of care needed to change and needs to change for women in the postpartum period. And so she switched from doing emergency medicine, determined to restore dignity to patient care. She established the concierge medical practice, EM Care to You. And she has a particular emphasis on postpartum care. And she authored the book, What to Expect Next, which is a postpartum guide aimed at assisting mothers in planning for a healthy postpartum journey. And she's also the host of the podcast Fourth Trimester Voices, where she's created a platform to have meaningful conversations surrounding postpartum challenges, maternal health, and healthcare advocacy. I'm grateful that she's joining us today on the podcast. So let's meet Dr. Chowa. Welcome, Dr. Chowa. Thank you so much for being here.
Thank you for having me. So excited to have this conversation.
I'm always grateful for people sharing their story, and I have like an extra layer of gratitude for people who are in the medical profession for sharing their stories, um, because I think they're, I don't know if it's like a stereotype or if there's
Mhm.
like an additional pressure. I think, anyways, that you probably have that you're since you're a doctor, you're a physician, that you don't deal with stuff, or I don't
Mm.
know, some sort of thing that happens in our perception of folks. So to know that you yourself have experienced quite a lot, and now that you're helping other people, I think is really powerful.
Absolutely. My journey, even just going into medicine, starts with a story, right? Being originally from a country of 1 million people, a small kingdom in Africa called Eswatini, I got to witness a lot that led me into pursuing medicine. I saw illness and suffering at a very young age,
Mm-hmm.
and it really propelled me in this direction. So my story generally doesn't start off as, hey, I just want to do medicine.
Mm-hmm.
I was introduced to that because of what I experienced as a child. And so I was led in this direction. And every step of the way, just because I'm going through this journey, it doesn't mean that life stops lifing.
Right.
Challenges come.
Yes. Yes, they do. Yes, they do.
Absolutely.
So, I mean, you've been practicing medicine for a bit, and while you're in your field, you had your own experience with um, postpartum challenges, pregnancy and postpartum challenges. What happened for you?
So I'll kind of back up. Before I had my current child, so I have one child, I got married in 2016 and immediately thought about having children with my prior spouse. And I got pregnant for the first time during my first year as an attending. So I had just finished my residency in emergency medicine and then got pregnant. And nothing, didn't think that I would suffer any complications from that. Thought, hey, this is just going to be this beautiful walk. I'm going to be pregnant. It's all going to be lovely. And ended up having an experience of loss. I had a miscarriage. My child had stopped growing at 6 weeks. However, I was discovered to have a missed abortion at 12 weeks.
Mm-hmm.
And that entire experience was one of the most traumatic events, probably of my life. And it's the reason I even start with it because it really has a great deal. It contributes a lot to my second pregnancy. I struggled for about 1 to 2 weeks, just miscarrying the child. I had a lot of challenges within the healthcare system trying to call my OB, trying to get help for that situation, and ended up just having one of the most traumatic experiences. And I thought to myself, oh my goodness, if I, as a medical physician working in this hospital, am getting the care that I'm receiving now, I can't imagine what other moms are going through.
Mm,
So that was, in the back of my head when I conceived the second time. The fear of losing a child that entire 9 months. Just, they tell you it's not your fault, 1 in 5 pregnancies ends this way. It's not you. However, you still have a little bit of a blame for yourself if you haven't processed that.
sure. Yeah.
So the entire 9 months, I was just really nervous and really scared about losing the child. And then when I finally got to 9 months, right, there was that excitement that, okay, I've made it through this like really
Hmm.
significant pregnancy. Like this is the worst of it is behind me.
Hmm.
Then I had a traumatic childbirth experience, right? I was induced at almost 41 weeks, 40 weeks and 6 days induced, and the induction was fine, 8 hours. And then right when it was time to push, I pushed within 5 to 10 minutes. So it was very precipitous. And
Hmm.
they had to find the OB who was delivering a baby elsewhere. And so the baby sat in my canal for quite some time and ended up inhaling amniotic fluid and ended up in respiratory distress and ended up in the intensive care unit. And all my birth plan, everything I thought would happen,
Hmm.
this wonderful experience of bonding, uh, I didn't have that moment
Hmm.
to have. And I really think that just that whole experience really was the gateway into my experience postpartum.
Hmm. I mean, that's all, um, it's such a 180. I mean, in a very short period of time to all of a sudden be going through this medical process and not having the experience that you wanted to have. Like it just, psychologically, it takes a long time to
Hmm.
catch up with what is actually happening that, like, sometimes it's happening so quickly. Um, so, I mean, in that, from the time of induction to the time of your child going to the NICU, what time span are we talking about?
I would say that once, there wasn't a lot of communication. And I know there wasn't not a lot of communication because that's one of the things that rings out when I think about that experience. And so when my child was born, finally when the OB came and delivered the child, she didn't cry. She had a great, hue to her. I thought, unusual color, but I wasn't thinking, oh, she's in distress. And so he suctioned her. My husband at the time cut the cord, and then he gave me the child, gave me the baby. The doctor did, and I'm holding, and he's trying to stimulate the baby, and I knew something was wrong at that point. And so I saw him back up slowly from the bed, and then he left the room. And then soon after, maybe within 5 minutes, a team of people came in. And they came in and they asked to take the baby. They told me they needed to get the baby cleaned up. Now, my medical brain knew because there was several people, I knew that wasn't the case. And so at that moment, my heart just dropped. And one of my good friends who is a physician, emergency room physician, called me around that time. And I told her I needed her to get there immediately
Mm,
because my husband didn't know what was going on. And I knew deep down what's going on. Somebody who runs codes all the time, I knew what was happening. And I needed an advocate to be in the room for me because I was also paralyzed from the epidural, couldn't walk over to see what was happening.
right.
And so they had my child. I saw a lot of, stimulation, a lot of suctioning, and then they started giving the baby oxygen. I asked, what's going on with my child? Oh, we're just giving her oxygen, just trying to weigh her, giving her oxygen. So they would just stand there, suction, blow by oxygen. At this time, my friend came in. This is a 10-minute, span of time. She came in, she's watching, and she looks at me. She comes and whispers, and she says, baby's oxygen levels are really low. They're giving blow by oxygen. They keep trying to get the oxygen levels up, but I think she needs more. And so I'm going to figure out what's going on. So my friend at that time advocated. She's like, are you guys, I think there's respiratory therapy and some nurses. Are you going
Mhm.
to call the team? Are you going to call a doctor? Baby needs this. So they managed to get to move the baby from my room to an intermediate unit, and eventually baby required CPAP, required external oxygen, and ended up being taken to the NICU. But in this span of time, it's probably about almost an hour has gone by because my friend was gone for an hour.
Mm.
So for an hour, I don't have my child. For an hour, I'm trying to figure out what's going on. And the only person communicating with me is my friend. And I know they were doing everything they could to resuscitate my child, but also that feeling of knowing that I have no idea what's happening. I can't move,
Right.
and I don't think I have control of the situation. Really difficult experience to have.
Gosh, absolutely it is. And like you know what's happening, but you don't know what's happening at the same time,
Mhm,
and you can't do anything.
mhm.
Like physically, you can't do anything.
Yeah.
Um, it sound. I imagine it would be excruciating.
It was awful, even when I tell my story sometimes, you get a little I wanna tear up because
Sure.
it's just, you don't expect this to happen, right? No matter I see so many complications all the time, working in the emergency department, but you never expect this, for you to go through such an experience. And so being in those shoes, being on the other side, feeling hopeless and not
Mhm.
knowing if my child is going to make it through was a really difficult experience for me. And I would say that the thoughts that are going through your head are, if my baby makes it out of here, so if she doesn't die, if she makes it out of here, is she going to have a normal life? Is she going to have a normal brain? How long has she been without oxygen? What is she going to look like when I finally get to her? Just
Right.
crazy thoughts,
Sure.
you know.
Yeah, yeah. And I mean, an hour in that state is it has to feel like more than an hour.
Hmm.
Like feels like a very long time. Well, if thank goodness for your friend. And I mean, you had the wherewithal to get her in there, and that she could support you in that way. I mean, almost sometimes when I hear stories like this, I feel like there should be one person who's just dedicated to interpreting, like to explaining and talking,
100%.
and like that's their job. Um,
100%. I think that is that between the healthcare system and you, and I'm thinking I'm a doctor. They could speak, to me, but in that moment, my mind, I'm a mom,
yeah,
so I
yeah.
can't understand what's going on. And so, before I got pregnant, I didn't think I needed a doula or anything,
Mhm.
because I'm like, I got this. I understand all this. I can communicate. But my friend served in a way. She was kind of like a doula for me,
Right, right.
she was that advocate that I needed. So
Yeah.
somebody needs to be there to explain this is what's going on. Ask the questions because your brain is just going through so much that you may not be able to comprehend or remember what
Hmm.
people are saying at that moment.
Absolutely. So well, how long was it before you could actually be with your baby again? And what was,
Ooh,
yeah.
I would say it was about 3 hours. I feel like
Mm,
it was 3 hours.
long time.
Yeah.
Long
It
time.
was 3 hours before I could see my child. And um, when I finally went in to see her, the worst part for me was watching her hooked up, right? She had an IV. She had this big old breathing machine. She had a feeding tube. They had already started pumping her with formula, and to me, I was like, she was on a monitor. It was
Mm,
not ideal. Um, my vision was that she'd be born and she'd be, suckling at my breast and I'd be bonding with her. And I could just only you can't even pick her up the way you want her to. She
mhm.
has all these things there. And so it was that was hard.
Absolutely. Right. So you can't, I mean, like you said before, none of this was on your wish list. And you're having to adjust in real time, but it's like there's a level of just like shock to it all, I assume.
Mhm.
Um,
Mhm.
so what were the days or hours and days like that after that for you?
So, one of the biggest thing that bothered me at that point, which I know for a lot of moms whose babies go to the NICU, was, my child was receiving formula. And so there was the added pressure of worrying that I'm not going to be able to breastfeed my child because that was one of the things I wanted to do. I want to exclusively breastfeed my child. And that is what I will do. And that was the pressure I put on myself. And so what I did was when I was not with my child, I would go back to my room and I would pump.
Mm,
And I remember I would pump and nothing would come out. Eventually called the lactation specialist. She says, colostrum is hard to come out. We just keep pumping. Once you can get baby on your breast, it will be fine. Just keep pumping. I pumped for 4 days and not a drop came out, not a drop of colostrum, nothing came out of that bottle. And it got to a point where I didn't sleep. I
mm,
barely slept because I was just pumping. And when I was not pumping, I was trying to check on my child. I
right.
would go and check on her. I wanted to do whatever I could to be near her. My team was so grateful because once I was discharged, they actually gave me an extra day to stay in the hospital so that I could be close to my baby, so I didn't have to go that distance of going home and coming back.
Yeah.
So I ended up staying, I think, 5 days and was able to go back and forth to my child. And um, I think that the feelings of sadness, the feelings of hopelessness, the feeling of inadequacy weighed really heavy for me because
Mhm,
I couldn't do anything for my baby.
mm,
They were feeding her with the feeding tube. Um, I think the most that I could do, the activities that I could do with her was bathe her. Just wash her. They let me do the first wash, washing her hair and changing her. And once she got the feeding tube removed, I was able to give her a bottle. And I tried to get her to latch on my breast. She would not latch on my breast
mhm,
at all. We tried and did everything we could. And when we were finally discharged from the hospital, they discharged her breathing very fast. I remember being like, is this normal? Because she looks like, she's sweating when she's eating, she's breathing really fast. I just don't know if I can really do this at home.
mhm, mhm,
They're like, no, this is going to get better. And so they gave us the baby and put us in the car and sent us on the way with a baby breathing very fast, a baby who's on formula and had literally just had a NICU stay. So that was pretty rough.
Um, right. So, I mean, what does that do to you when you get home? Are you just on high alert?
High alert. High alert. The car ride home, screamed at my ex-husband to, with the bumps and everything that was going on. I'm like, slow down. I'm
Right.
watching my baby. I'm trying to hold her to make sure her head doesn't bump. I remember when I always tell my patients, I'm like, when I got home that day, my friend goes, "Isn't this the most amazing thing? Aren't you just so happy? And isn't this everything you wanted?" And I remember just looking at her, and I was like, "Yeah, you know." It was like a yeah, because I had so many thoughts that were going in my brain. I didn't know how I was going to sustain this child's life.
Right.
I She had just been through a lot, and now I had to do this. And so every day after that, I would sleep right next to at the edge of the bed, so she was at
Sure.
the foot of the bed. I would
Yeah.
watch her breathe.
Yep.
And so I never slept. I watched her breathe. I pumped.
Hmm.
um Nothing. It was a challenging probably few weeks for me going home.
Of course. Uh, okay. So, I mean, right, you're hyper vigilant. Um, because on one hand, you kind of need to be. On the other
Mhm.
hand, like loss of sleep just does a number
Mhm.
to you anyways. And
Mhm.
um, m- after a certain period of time, you just feel like kind of wired.
Yeah. Yeah, no, I was wired. I was wired, and I think I was hard on myself because I was still perseverating over breastfeeding too.
Mm,
So I tried to, breastfeed. I was unable to. 3 days, went back to the lactation specialist. She gave me something called a supplemental nursing system where you attach a tube, a formula on your breast, and baby learns how to, suckle and latch, gets formula, and is also stimulating your breast to produce milk. I did that for some time. I was managed to maybe get an ounce of breast milk, but truly my breast milk was not, this was not going well. And went to my pediatric appointments and the OBGYN appointments, and I scored badly, on the Edinburgh
yeah,
postnatal screen that they
yeah,
make you take.
yeah.
It's interesting. They make you take it, but I feel like they don't really give you the resources to deal with it.
It's a
And so
problem. Yeah, that's a problem.
so I took yeah, so I took the test at the pediatric office. They're like, "This is bad. You should really get some help." And took the test at my OBGYN's office, and he was just like, it's probably a really rough time right now. A lot of women go through this time, but you can do it. Every woman goes through this time. It seems like the worst, but this too should get better as you're able to sleep more. So let's just keep an eye on it. And so I went home, but I knew I was depressed. I had a feeling it was a little bit deeper than just your normal baby blues.
Right.
Um, I just, as time went on, I lost myself. I would find moments just crying out.
Mhm,
I was angry. I had outbursts. I just was a not.
mhm.
I was not me, and thank God my neighbor would come over and check on me every day. She just noticed some changes in me, and
Oh.
eventually managed to get me the help that I needed.
Oh, well, that's amazing. I was gonna ask what kind of support did you have? Did anybody know what was going on?
So, culturally, um, that is depression is not something that you speak of. And so I think at one point, I remember one night I was having a rough time. I was upstairs staying up with the baby. She had colic, and my mother-in-law and husband were downstairs, and they were enjoying their time watching TV, eating, and I was crying upstairs, suffering with a crying baby.
Mhm, mhm,
And, just having thoughts of like, man, like I could just take the kid right now and just
mhm,
disappear,
mhm,
just not be here and maybe drive off a road. I don't know.
mhm,
Like we can just go. And so I actually took the baby, went downstairs, and I gave the baby to them. And I said, I have to go. And I got in my car and I
mhm.
drove, and I called my mom, and I said, I didn't sign up for this.
Right.
And I was like, I am depressed. I didn't sign up for this. And the first thing my mom said was like, where's your child? Where are you? I
Mhm,
said, I left her and I'm gone. I'm gone.
mhm,
She's like, where are you going? I was like, I don't know. I'm just
mhm,
driving. I'm
mhm,
driving.
mhm,
And she was just like, no, you got to go back. You signed up to have this child. You got to go back.
mhm,
Go back. You signed up. When your baby's sick, you have to be there. When baby needs something, you have to be there. You don't count on him to be there. You have to do these things. Just pray and it's going to be okay. And it wasn't the words I wanted to hear.
mhm,
Um, I think that was a hard pill for me to swallow.
mhm.
So
Is this
I
like
ended
a
up.
cultural, the support that she was giving you had like a cultural underpinnings?
Yeah, that's how that's just how she did it, right?
Mm,
She was a mom who had 3 kids, and she went to work. She worked multiple jobs. She came home. She cooked. She did it all.
mhm,
Granted, we grew up in Swaziland, and so I think she had more support. But even so, just being able to just do it all,
mhm,
that is something that she felt that every woman should do.
mhm.
And my mom is my biggest supporter right now, and so I don't know, I don't think she meant those words to come out in that way, but that was
Sure.
or that's how she
Mhm,
viewed motherhood,
mhm,
and
mhm,
so it did give me after sitting and listening to her, it actually helped me figure out that I needed the help, right? So I ended up just going home that day. And I think when my neighbor came over, she kind of told me, hey, get in home lactation. And, she talked about her own journey with therapy and everything that she went through and how it helped her and how to get a therapist. And so I ended up going on Psychology Today and researching a therapist. And that was the first time in my life I'd ever seen a therapist.
Mm-hmm. Mm-hmm.
First time in my life.
But it's which is a hard thing to do for the first time, for
Mhm.
sure. And it sounds like there's something in you knew that you needed it. You said,
Mhm.
okay, yeah.
Mhm. Yeah, I knew I needed help. I think I knew that it wouldn't come. I was in a dark place. I knew at that point that okay, I'm going to listen to what my, friend is saying, and I'm going to try to explore this and see if help is going to get me to a better place because this is not living.
Mhm. And how was that for you getting that help? How did it help you, if it did?
It was huge. Um, my therapist, who I owe so much to, right? She evaluated the 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 support around me, the people I had around me. She never judged. She never, made me make decisions. We just worked through different scenarios to try to get me to a better place, right?
Mm-hmm.
She helped me think about myself. I didn't realize how conditioned I was to think about others.
Mm-hmm.
And so I constantly thought about others. I thought about what the baby needed. I thought about what my husband needed. I thought about what my mother-in-law needed. I thought about what my parents needed. And I never ever thought about what I needed. And so I had no perspective. That was how I was raised. That's literally how I lived my life. Was worrying about others and then having to go in the hospital and worry about others,
Uh-huh.
you know.
Yeah.
So that was something that for the first time in my life, it was a me-centered approach. I just had never thought about what do I need.
Mm-hmm. So once you started thinking about that, I mean, it sounded like you needed sleep for sure. Um,
Yeah, that too. She made me do that.
okay.
So yes, I would probably say I always miss in my journey and all of that. The first thing that helped me was getting lactation to come
Oh,
to my
yeah.
house.
Okay,
And
good.
when lactation came to my house and saw me looking tired and just like a horrible human,
Mm,
and she saw me with my pumping supplies there, and she evaluated me and evaluated my breast and saw that I had something called glandular hypoplasia and
mm,
said no matter how much you pump you are not going to produce enough milk to get off a formula. And she, at that point, she embraced me and she said, I need you to forgive yourself. I need you to forgive yourself. It
mm,
was the
that's
moment
big.
I needed. It was
Hmm.
huge. It was huge. She was like, forgive yourself at this moment. And this is what I want you to do. You are missing opportunities to bond with your child by sitting here pumping every minute trying to get milk out. She said, stop pumping. Forget pumping. Stop doing that. Put the baby on the breast, let her suck whatever she has, just give her formula. Wear your baby every single moment when you can. So she made me wear my baby. I wore my baby how we wear it traditionally in Swaziland and wore her on my back. And I wore my baby every single day. I kept her close to me. And I gave the baby formula. But that, number one, released a lot of pressure from me
Hmm. Hmm.
and also allowed me to sleep some. Um,
Mm.
so
Oh,
that was step
sure.
number one.
Right, right. Wow.
That was step number one. And then when I got to therapy, she was very intentional about, having me do certain things like, setting reminders to take a shower. I know this may not be big for people, but like,
It is.
setting my alarm to make sure I eat, trying to get back into the things that I love doing. I'm a musician, so I love playing the piano, and so trying to play the piano, taking walks, getting sunlight. I love cooking. She said, one day, I want you to get up, dress up, put some nice clothes on, put makeup on if you want to, go downstairs and cook. And then really she had to destroy those intrusive thoughts that came in
They're the
about
worst.
Yeah, we had to break those intrusive thoughts. And so I would name what intrusive thoughts were coming, and then we would have to break them down. We would have to counteract them. And I had to do a lot of those exercises on the daily because I was, in an environment also. My home environment was not really great. My mother-in-law and my husband were not the most supportive. And so I had to counteract those
Mhm.
voices as well. And so it was a huge healing process for me. I would say that I didn't really even start to feel myself until a year. A year later, I think I got pieces of myself back, and then year two was my better year, my thriving year. Um, and so I really went through that, and I think 3 years later, I actually 3 or 4 years later, I got to a place where I had to make a decision for my life, and ended up getting a divorce at that time because I was not in a great home environment either.
Mhm.
And so, yeah, just I felt so amazing, empowered to make so many decisions that benefited me and were
Right.
best for me. And so, just a lovely place to overcome that, to think of where I was before, and having somebody to help me along the way was just godsend.
Mhm. Right. I mean, that is a lot to go through to to have this transformative also experience. Like it,
Mhm.
whatever. Pardon me. Whatever. All the things that came up from all of the medical stuff, that was his own intensity. But then this like healing that you had to do, or that you did do, you chose to do
Mhm.
for yourself, sounds like also healed some stuff that was there already.
Yes. Yeah, no, there was a lot of low self-esteem. There was a lot of, just emotional abuse and things that were happening, and all stemming from the fact that I didn't love myself and I didn't love who I was. And so therapy helped heal that.
Hmm.
It empowered me in a way that I can never forget. The decisions I make, the way I move through life now is literally because of that process that I began after giving birth. And so I always tell people, I said, my child saved me,
Hmm.
and it was a difficult time, but my child literally saved me. And I'm a better human because of it, because I just went through this journey and still go through this journey. But
Sure. Yeah.
I'm just a better person, better physician because of those experiences.
That's amazing. It is a long period of time to walk through all of that intensity. But I'm so glad you found that healing and you got to the other side. And I'm not saying, you know, um, healing is a process, not like you like
Hmm.
get to the mountaintop one day and you're like, all right, we're
Exactly.
all done here. Uh,
Ongoing process,
yeah.
ongoing process.
And that you are using your experience to now support and help other people. Can you
Mm.
talk about, either how your experience shaped what you're doing now, or just what you're doing now to support others?
Yeah, I can totally touch on that. I would say that after so during I went through COVID. So once I got through this once I
Oh,
got
there's that.
through there's that, right?
Yeah.
Once I got through COVID, what ended up happening was I was working through COVID, really difficult time, and so just the experiences that I had from that, I went into administration during that time and really saw medicine in a different light.
Mm.
And I questioned about how I would want to live out the rest of my life. Right. The wonderful thing about therapy that helped me was I'm always constantly reflecting. Am I happy here? Do I feel present here? Is this what I'm supposed to be doing? And so, working through COVID and seeing the impact of COVID on our communities and seeing the impact on the lives of others, I thought to myself, is this how I want to give and do medicine,
Mm.
right? Do these patients who are coming in and lining up and, hundreds plus in the emergency department, is this a dignified experience for them? How can we prevent them from going through this process, right? I tell people a story. I was working in admin and I was reading a patient complaint, one of the things I would do is I would read patient complaints all day and make suggestions for quality improvement. And, there was one complaint that came in, and a mom was, talking about her experience postpartum in the emergency department. And I hated that because I was like, this is not a good thing. This is not a human thing for her. And I just wanted to practice in a different way. And so I decided to transition and do something called concierge medicine, which is basically personalized care.
Mhm.
And it brings a lot of compassion back to medicine. It personalizes care. You're not treated like the standard, which standardization is great, but now you get on a different level with your
Mhm.
patients. You become their family. You come in their
Yeah.
homes. You just are woven into their daily process, their families. And so I wanted to pursue this. And so I ended up quitting my job in academics, full time emergency medicine, and I pursued this dream. And somewhere along the line, I initially thought I'd be seeing urgent care, primary care. I didn't think that I would have this sort of impact on moms.
Mhm.
But somewhere along the line, I got a call in the afternoon, and it was a mom who somebody had referred to me, and she was telling me she had gone to the doctor's office and she wasn't feeling good. She had some abdominal pain, her legs were swollen. When she got there, her blood pressures were a little bit elevated, but the provider there told her she was dehydrated and that's what was causing all of this. And she said she went home, but it didn't sit well with her. And so she posted in a Facebook group, and somebody referred her to me. And so that's how we got on the phone. And I'm talking to her and I was like, something's not right. I have
Mhm.
to come and see you. So I went over there on Saturday, took her pressures very elevated, 150s, 160s, over 100. I said, I'm really concerned about your blood pressure. But let's figure out everything else that's going on and we'll recheck it. So we rechecked it, try to communicate with her OBGYN who was on call, waited a while to hear back from somebody, eventually sent her to the hospital. They gave her medications, blood pressure medications, and then sent her home. And so that entire weekend, it was a holiday weekend. Her pressures were high. We were trying to, manage it, change her medication out. I kept calling the on-call physician because I really felt strongly that she needed to be admitted,
Mhm.
and got her to the point where she made it to her a doctor's appointment on Monday and ended up being diagnosed with postpartum preeclampsia, which I had already known
Mhm.
that's what was going on, but just being really fearful of her that weekend and not having the
Yeah.
support, the medical support needed,
Mhm.
because it happens. There's a lot of moms
Yeah.
whose blood pressures are elevated. They go to sleep, they never wake up.
Mm.
And that reality scared me. And so dealing with her at that time, that moment, and then seeing some other clients. So she ended up referring me to other moms, and I started getting calls from moms and seeing other clients go through that experience. It was like a weird aha moment, a full
Right.
circle moment for
Right.
me,
Right.
because it was like, oh my goodness, I remember what I had gone through. And
Yeah.
so this is it. This
Mhm.
is literally my calling. This is what I'm supposed to do.
I love that.
And so
Yeah.
yeah, it was just such a it just came so naturally.
Right. Right. So I mean that is so needed. I mean, it would be if it'd be great if everybody had somebody like you to support them because I mean, it's hard to get in touch with a provider sometimes. They're
Mhm.
busy, even the office. Um, all of there's so many barriers to getting what you need when you need to get it. Um,
Yeah, absolutely. And even just getting to the hospital, right? Or getting to the clinic. Especially if you have other small children, you have a baby now, right?
sure,
There's the
right.
transportation. And so being able to talk with somebody, and too, sometimes I think moms, you don't know what's real. Like, for example, she was like, something doesn't feel right, but they told me I was dehydrated, and I don't know, being able to get another, opinion, or to seek out somebody else's help and say, what do you think about this? Right. And it's
Hmm.
different. It's coming from a different lens. I
It's like
can look at it.
collaborative care.
It's collaborative care. And, and what I love most, because there are amazing birth workers out there who are able to watch out for mom and look out. And I think that one of the things where I feel that medical advocacy is needed too is because I also can speak in a way with my medical colleagues, right?
Mhm. Mhm.
I have that medical sense. Like I can look at somebody and tell you need to go to the emergency department. You
Mhm.
know, I can get on the phone and say, I'm looking at mom. Something's wrong. I'm going to send her into you.
Right. Right.
It's just a little bit, it's a little bit different. And so I just love to work with everybody to support mom and to say, I'm here. I'm here on your behalf and we're going to get through this.
Absolutely. Um, right. And especially, I mean, there are so many things that can and do happen to people during pregnancy and postpartum, medically, where if
Hmm.
they had an advocate, it could save their life.
Absolutely. This morning, actually, and maybe 6 days ago, Wall Street Journal published an article of a lady who died of postpartum preeclampsia. And what happened was she went into the hospital, got, was given medications for high blood pressure. And sorry, but she went into the hospital to the clinic, was diagnosed with high blood pressure, given medication, sent home, and she never woke up. Right. She never woke up. It sounds like when you read the story, she started having some symptoms, but she wasn't sure about going back to the hospital after getting the medications because she was thinking, well, they gave me meds, they sent me home. So, let me just kind of be here. Right. I truly feel like sometimes women need you to call them, to
Yeah.
follow up with them.
Yes.
It's not like we're so reactive in medicine. We wait for things to happen. So
Mm.
we're waiting at the clinic's door or the emergency department, waiting for patients to come to us to say, "Hey, I don't feel good," or "Hey, this is what's going on." We can't be reactive in medicine. We actually have to meet patients where they are. We have to be proactive. So
Mhm.
if you send a mom home who has high blood pressure, who had preeclampsia during, pregnancy or childbirth, let's call her. Let's send a nurse to her house and check on
Mhm.
her,
Mhm.
right? Let's make sure that, 6 weeks, like if you don't hear from a mom and you're thinking everything is well, in that 6 week period of time, they'll come to me, I'll see them 6 week. It's not really enough.
No.
We have to go to them, and a lot of countries have done this really well.
Mhm.
Um, France and some of these European countries, they don't wait for moms to come. They're sending people out to their homes to
Yeah.
do these checks. It's
Right.
imperative.
It is. It is. So, that's it's essentially what you can do. Um,
Yeah, I go to the house. I go to my patients' homes, and so if somebody signs up to work with me, generally by the time they come home, I meet them within 2 days. But they have my cell phone, so if something happens during that first 48-hour period, if I'm not there, they can talk with me. I'll be in their
that's
home.
amazing.
Yeah, and the lovely thing, I always advocate one, every mom needs to have a blood pressure cuff in their home, and
Mhm.
so I give them I published a book called What to Expect Next, and it's a guide that talks through each week, and it breaks down what your body should be experiencing, and it helps moms do like a check-in.
Mhm.
What symptoms am I experiencing? What is my blood pressure reading? And it just goes through they writing all of these things down, just being hyper aware, and we
Right.
go over this each time. So when I see them, we're like, well, tell me a little bit more about this
Mhm.
experience you're
Mhm.
having.
Mhm.
But it's just trying to make sure that moms are checked on. And they also don't have a lot of time to be processing what their body is going through because we're
Right.
told it's normal,
Right.
right?
Right. Yeah.
It's like, yeah, this is normal that's happening. And then it's like, but it's not normal. Like
It's
a
not
lot of
normal.
moms think leaking is normal. They're like, yeah, I just carried it, I just, had a baby and
Mm.
I'm leaking all over the place. That's not normal. You
Mm.
should not be leaking, when postpartum. You should not. It's not normal. This is something that will need to be addressed.
Okay. So we have to replicate you in the millions.
I
uh,
I I feel so if I could, I think it needs to be a standard. Like
uh,
I just think that
yeah. Yeah.
like this just has to be a standard of care. And I always say a lot of our birth workers are busy. For example, our
Sure.
midwives and OBGYNs are busy.
Yeah.
I think the expectation that they are going to do this comprehensive, holistic care for their clients is really, it's asking for a lot. I think midwives are trained in that way, and so they're
Mhm.
more alert
Right.
to do this holistic care.
Yeah.
But our medical providers come from also a reactive system, and
Mm.
they have their research. They have their, they have to keep up with the policy, the birth outcomes. They're doing so much, and then still maintaining their own lives while being on
Right.
call every
Right.
3 4 days. It's not going to come from them. This is a community approach, and so I. For me, being an emergency room physician, it's almost like I've seen the complications, so this work, it almost makes sense because I
Right.
have the flexibility, I have the training to be able to care and help in this capacity. But yeah.
Absolutely. And it's the other way that you're helping is through your podcast. Can you talk a little bit about that? For fourth
Yeah.
trimester voices.
Yes, absolutely. So I started fourth trimester voices because, as I'm telling you my story here, that took a lot of time to get to a place where I was able to talk about my experiences.
Right.
And I do it openly now because I want other women to know that they're not alone going through
Hmm.
it. And so I
Hmm.
think for a lot of moms, they have to understand that you're not alone going through this time. And so just providing an avenue for them to listen to other stories of other moms who've gone through similar experiences, and also get expert advice from birth workers who have experience in working with them as well, because
Yeah.
a lot of moms don't even know there is a pelvic floor therapist, or that they need a
Right.
pelvic floor therapist.
Right.
Right? A lot of moms don't even know that they can get a lactation consultant in their home. Right? A lot of moms are not even thinking, well, how can a therapist help me? How can a postpartum support group help me? They're
Right.
not thinking in this way. And so just providing this avenue is super important for moms to know. And so I named it Fourth Trimester Voices because I wanted to know that these are people who have been where you are,
Hmm.
and you may be able to take something out of this, and it may help you get through this crazy time, right?
Hmm.
Crazy time when you may not have anybody there to talk with.
Um, right. I mean, it's super powerful. Hearing story and learning from other people's experience in the way that you're doing is on your podcast, and that you're doing here for us to learn from your experience as well. I don't. There are a few things that are as powerful as hearing a personal story and resonating with it, and that prompting you to like get the help and support that you need. Um, like us, we're sitting here, we're having this really important conversation, and it's going to go out into the world, and who
Mm,
knows where it's going to land and who it's going to get to, but there are going to be a lot of people who need to hear your story and need to
mhm.
hear your experience, and to shift perspective, and to offer a different paradigm on how care should be managed, or provided rather. uh, yeah, it's needed, and I'm
Yeah.
really grateful that you are doing the work that you're doing.
Yeah, no, I think that getting moms and just getting our system to understand that, we this is such a time in our country. I mean, there's a lot of noise and buzz around maternal health, right? And there's solutions that are being thrown out there. Like we need to train more midwives. We need to, increase doula support for our moms, but also just that comprehensive piece of it, that
Hmm.
holistic piece of it.
Hmm.
There are ways we just have to fine tune that,
Right.
because right now there's a lot of fragmentation in
Absolutely.
medicine, and it shouldn't be that way.
Yeah, absolutely. I totally agree, and especially with the comprehensive part. Like it's also unfair to put the problem on like doulas and midwives to fix. Like,
Mm-hmm.
let's just
Mm-hmm.
fix all of it,
Exactly. Exactly.
and just do better
Exactly.
in general.
Exactly. Yeah. No, that's not it.
Nope. No, it's not. So with all of the work that you're doing, obviously people can check out Fourth Trimester Voices. They can get the What to Expect Next postpartum guide. And what are other ways that people can be in touch with you?
Sure. So I also have a support group that's called Beyond the Fourth Trimester. It's a postpartum support group, and it's on Facebook. And so you can join that if you're looking for extra support. I also am on Instagram, Facebook as at Dr. Chowa. And if you're looking for comprehensive care and you're in the greater Atlanta area, you can find my business at EM Care to You.
I love it. I love it. EM care to you.
Yes.
That's the best. It's really good.
Thank you.
Yeah. Well, I thank you again. Thank you so much for coming on and sharing your story and your passion and your care for new moms.
Thank you so much for having me.
Thank you again, Dr. Choa, for joining us today. If you'd like to get connected with her, go to at Dr. Choa or at EM Care to You and the website emcaretouYou.com. And please take a moment to share this episode. It is really important that we get messages like Dr. Choa's out to people so that they can know and understand not only that they're not alone, but also what their options for care are. And if you haven't yet, go to your podcast platform where you're listening right now and rate this show so that more people can see the ratings for the show and know that this resource exists. I thank you so much for being with us today. Until next time.